I personally feel just enormously grateful, humbled, honored to have you here with us, my class. To be able to hear these stories is incredibly rich. On a very personal note, my 13-year-old daughter, I really can't imagine, honestly, a more inspiring thing to be able to give a 13-year-old girl than the stories that you've brought to all of us today. So thank you for that. It's very, very special. We have and are really, really lucky to have with us also Senator Tim Wirth and former EPA Administrator Gina McCarthy. And I'm not going to spend a lot of time introducing them because we want to get into this discussion. But both Gina and Tim have spent a lifetime in public service. Gina, under President Obama, ran the United States Environmental Protection Agency as the administrator of the EPA. Before that, had years and years of service in both Connecticut and Massachusetts at the state level, working in both health and environmental protection. Tim Wirth has also had an entire career in public service, was a representative for the suburban part of Denver in the U.S. House of Representatives, and then in the United States Senate, went on to work as an undersecretary in the State Department, and then as president of the United Nations Foundation. So both deeply, deeply steeped in public service related to environment and health. And I guess I'd just be curious to start to get both of your reflections on what you've heard this afternoon before sort of opening it up to questions from the audience. Do you want to start,
I
Gina?
have to say that you've made me feel totally inadequate. Don't you have the same sense?
Did I just say that to you?
No. It's just, these were amazing stories. You are unbelievable human beings, and I'm really proud to be the same sex. That's all. That's as close as I can probably get. But at the same time as I feel like I feel just elated about the work you do and pretty much astounded by it. I went to Indonesia once and they wouldn't let me in Borneo. Yeah, I was checking out palm oil plants.
Oh yeah, they wouldn't let.
And they didn't like me. But it's okay. I lived with it, but I really wanted to go there. I at the same time as I feel like it's wonderful, I just have this pit in my stomach to realize how human beings are living in areas and how not. I almost feel like the life that I live is just not. It's not right, because of how difficult it is for other people's lives. And I just, because every day I think in my life, you try to do something and learn a lesson that provides a systemic change. And you people have done that in a tremendous way. And your commitment is really inspiring. But I just kind of have to wonder how we get out of the dilemma that we're in, where there is such social inequities, where we have such disparities. And how do we get from ideas like you have that really took a lifetime commitment? How do we make that easier? How do we duplicate that? How do we get people engaged? Mm-hmm. My life has been, how do I make climate change real? Just give me any one of these stories and you can't walk away from them. You just can't, not if you have any feelings as a human being. Mm-hmm. So I just want to thank you for reminding me of why what we do is important, and it probably gives me a kick in the pants to continue to recommit every day. So thank you for that.
Thank you.
It's amazing.
Let me just say, I would echo what Gina said, and you're just a remarkable group of people, as are just remarkable women all over the world doing extraordinary things. I'd like to just make three quick comments. One, when the previous Secretary General, Ban Ki-moon, arrived in New York, he had been a Korean bureaucrat, grew up in the Korean Foreign Service, very, very rigid hierarchical system. And we went and talked to him the day before he got sworn in and asked him what his priorities were. And they were twofold. He started out of Iowa. One, climate change, and second, the empowerment of women. Mm-hmm. I thought, isn't that remarkable and isn't that wonderful? And he followed that out for 10 years. Institutional commitment being so terribly important to try to set the framework, for, you would get down all the way across it. That's the first point that I would make. The second, in the time that I was working with the UN for 20 plus years, we started 20 years ago. There was no focus any place in the UN on the issue of energy. There was no agency, there was no priority, there was nothing focused on energy. And over a 20-year period of time, we have built Sustainable Energy for All, contributing, I think, to what each of you is doing one way or another, run predominantly by women, to focus on advocacy, focus on supply of energy, for those who don't have it, focus on efficiency. The institution of the United Nations is trying to respond very hard against resistance in so many different places. But my God, you all make the stories that make it so very real. The third point that I would make is that we must keep in mind in all of this the issues of reproductive health and population. We're now at 7+ billion people in the world, with close to 500+ million women and families who want reproductive health care services and can't get them. A tremendous gap. And how are we going to fill that gap? Probably there is funding now for about 225 million. That leaves a very, very broad need, which is going to have to be filled so that the women and families who want to be able to control their reproductive health, who want to make choices for themselves about the size of their families and spacing of their children, who want to look out for their own health, have the ability to do so. And the pathway to reproductive health, it seems to me, is one very, very important piece of it. Very hard politically. It's an area that's extremely difficult to get funded politically. We spent 8 years under Obama holding the line anyway. The British have been terrific and helping to fill the vacuum, but that still remains. Now we're talking very, very big numbers, and this is sort of flying at 35,000 feet when you all are thinking in the most real way at where things are really happening. But it's very important to keep in mind that there is this framework and that there is this major need that exists and is going to have to be filled. It's hard to do, but we still have to keep focusing on that as a highest priority.
Thank you both. Conscious of the time, I want to open this up to questions from any of you. I know I have some, but who has questions for any of our panelists?
Thank you so much. All of your speeches are amazing. I wanted to ask, it seems like, if I understood correctly, each of you chose a nonprofit business model, and I was wondering if any of you considered more of a social business model or have aspects of that in your programs, or are considering shifting in that direction for the long term, or just how you balance that trade-off.
So when we started, especially when we realized we had a product, we had the choice to think about whether or not we wanted to do a for-profit or a nonprofit model. I mean, my underpinnings in general, I think, are more leaning towards nonprofit, but we actually met with some venture capitalists who talked to us, and what they wanted to do immediately, and this is when we had only done 7 clinics, they wanted to make 10,000 solar suitcases and take away some of the bells and whistles and said, let's strip it down and make the most ubiquitous product and get it out as fast as possible. And I really felt like I needed to see how things would work in the field. In fact, there was 2 years where we were bringing different prototypes, meeting with midwives, seeing what worked, seeing what didn't, what do they need to happen. And I felt like having that kind of pressure to make something that was just going to be mass produced at the cheapest level possible wasn't necessarily going to be addressing the problem. I think when I've gone to a number of kind of incubators for social businesses now, and I think you can do things in different ways, like you can get capital in different ways, but you have to see if it's going to meet your objectives. And for me, I felt like I mean, I'm actually really glad we made the choice. I didn't want to end up with 10,000 products and 9,500 of them not being the right fit for the need. And I was very lucky that we got this very large MacArthur grant out of the door, like $725,000 for an organization that had no history. So it was pretty amazing. So that gave us the luxury of being able to go the nonprofit route.
So for us, we've kind of been doing some hybriding. We now actually are, the hospital is a provider for the government health insurance system. And we probably will never fully get all the money we need from the government, but we will likely be, our patients also, many of them pay with cash, and we're making about half of the healthcare portion of the work. There's also different models for so now after 10 years, we did another round of radical listening. In the beginning, all of the needs were human health needs and human well-being needs. And now they want to do restoration. And there are sources of funding which are about, for replanting trees that actually are not, they're still, it's not a, it's basically people who want to plant trees in the developing world, and they are making money in some other way, and then there's some portion of that is going to trees. So we can actually probably get, sort of connect it in that way and get sustainable source of funding in that way. So those are some of the things that we're looking at.
I just want to add something for any of you that are thinking of starting social initiatives nonprofit. It's not that you can't sell things. It's not that you can't have customers. And in fact, right now we have customers like UNICEF buying these or other UN agencies. And I think actually even if you're a nonprofit, foundations like to see that you have some form of sustainability in your model. So I think that you're mentioning about hybrid is a little bit more where it's at.
Yeah.
For us, it's mainly non-profit, but also we have the concept of, in terms of the women farmers, or even we have worked with the small-scale farmers, even men, in the last 4 years, to connect them with the private sector, like companies who, for equipment, machineries, or whatever inputs. So, but as an organizational work, is mainly non-profit. Even if we get to build the school or classroom, it's follow to the Ministry of Education, just to enhance the environment, so we can ensure that more girls go for school or other program, adult education, or so it's mainly a non-profit.
Other questions? Yeah.
Can you talk a little bit about sort of this connection between the sort of big picture policies, big picture, government programs, huge economies, and then how does that connect up, or what are the struggles you guys have faced in terms of connecting up sort of small local programs, one-on-one individuals? I know you're thinking about sort of scaling up or replication. Is that a daunting thought about how to move forward, or is that something that you see very naturally flowing into out of this particular local granular work?
I can address it.
Yeah, I want to hear what you both think too. For me, I believe really, really, really passionately that actually the only solution to our planet is a bottom-up driven solution, and that that the top-down work is utterly failed, and that we are destroying our planet and we are destroying ourselves as a species on this planet with that mechanism. But when you look at true bottom-up driven solutions, when you ask communities what the solutions are, and then you match them with global resources, because there's a reason they couldn't solve those problems on their own, right? They need something, and it's often they need knowledge, they need resources, they need they know they need the solar, right? They know that that's the right solution in many places, right? But they can't get that, right? They don't have the knowledge or the resources. And so if you can match them up, I think that you could truly have a bottom-up driven global way of approaching development, a global way of approaching sustainability on our planet. I might be wrong. I probably am wrong, but I that's the way I think we need to go. And I think that we should be funneling development money through systems where communities are determining exactly what they need. And I think we should be funneling government money that way too.
So for us, I totally agree that working with communities is incredibly important, but I also believe that there's great need. Like in this particular situation, there's about 300,000 health facilities around the world that don't have reliable electricity. And if I were to sort of use our what we call our high touch model, going in, working with communities, getting their investment, teaching everybody there to use this, it takes a lot of resources. And so we're trying to figure out how do you balance, the desire to work intensively with communities, just like you're thinking about wanting to replicate this, what's the special sauce that makes it work, but then how do you scale it because there's such great need and you don't want to take another 100 years to reach everybody that has these needs. So the way that we have done it so far is, as I said, this train the trainers approach and trying to teach people locally how to do things like these district health technicians, then have them go to health center. But I do feel that along the way, very often they'll miss out on initially, like our ideal model, we'd have the whole community would come at the time that the health center gets the solar electricity, and there's a celebration, and there's a handover, and there's a commitment to making sure everybody's going to be using the health center and replacing the batteries, but that just takes a huge amount of resources. So we're trying to say what are the key elements, and we're actually now working with a design firm to try and make the education process, which those train the trainer programs take 2 weeks of us being on the ground with district health technicians to say, how can we remodel the suitcase to be as easy to use as possible and to have education maybe something where they get a lot of the training on a phone? Because if you're going to scale it, you can't put in that same intensive level of resources everywhere. But it's a real trade-off. It's really hard.
Mm-hmm. Yeah, I think, we are in a situation or in our content where still too much issues and problems, and it related to illiteracy, to unawareness. So this needs really an effort and sustained effort from bottom up, as he said, or from grassroots, so they can make some sort of change, because it needs attitude change in all aspects. If to convince communities or to send their daughter for education or for awareness raising regarding bad tradition or regarding problems like HIV/AIDS or other health problem, maternal health, family planning. So this is need really an effort from at grassroots level, and it has to be sustained. I mean, it has to be something going on so we can make the change, because change is possible but not easy. Needs time. So.
Yeah. Can I just respond to this a little bit, because I do have to defend some government intervention.
We're very grateful.
Thank you. This is a really important point, I think, because I get this a lot when I go out, because people think that because the federal government in the United States right now is just, I'm going to try to be very polite, absent. Okay, it's the best I can say. And in fact, it's probably not, it's worse than that, because they're intentionally divesting of really critical things. One of the, people say, oh, the Clean Power Plan's going away. And the thing that bothered me the most was the defunding of the Cook Stoves Initiative that I worked really hard on with many people, including Hillary Clinton, and they did it because they said it was inconsistent with America first. I mean, really. But anyways, I'll try to get over that. But the point I was really wanted to make was, when I go out, people think that I'm going to be so upset. But honestly, everything good that you've identified at the local level is exactly the same way the United States of America grew up and got the resources and what we had. You didn't make any. There's nothing that happens at the federal or state level that hasn't been tried and tested and pushed from below. I say that every time. So I honestly believe that at this point in time, is it it not good that the United States is disinvesting at the federal level? Yes. Does that mean nothing's going to happen? Absolutely not. It just has to be a wake-up call to grassroots, and that's exactly what's happening. And so I do think that at some point in time, though, you have to have a structure that provides equity. You have to have someone that prioritizes where resources go. You know, you can't see consistent barriers like forcing girls and boys to go to the same school without saying, I have got a barrier here that without breaking through that, I have to continue to go community, when I know how to fix some of those things. So there is a role for government, but it in no way means that you divest of grassroots. In fact, that's how everything bubbles, and it always goes from the bottom up. There's nothing brilliant that comes out of the federal government. Just hopefully systemic ways of making sure that resources are effectively allocated, and and believe me, that's not always effectively done. But that's what you got to rely on. There are systemic barriers that only laws can break through.
Yeah.
Jim Wolfenson, who was a very successful head of the World Bank, used to almost every conversation, he would say, scale, scale, scale.
Yeah.
Let's remember the size and scope of the kinds of populations the kinds of problems that we face, how enormous they are, and then how do you build the institutions to begin to meet them? How do you begin to build the institutions to collect the resources? How do you begin to build the institutions that develop the rules and the standards under which they operate? How do you develop the institutions that are going to have some frame of legality around them? I mean, this is, again, I'm not like, I am not, what you all are doing is operating within that framework and doing it incredibly successfully. And let's hope that for those frameworks become as efficient as possible and as ethical as possible and as sensitive to the future as possible. I mean, that's the job that exists at this level, and it's extremely important. It's not to be denigrated. It's not to be sort of thought is a bad idea. It's extremely important, and it demands very good people to make that system work as well. It's not an either-or. It's a both-and situation.
I just want to say that one of the things we're doing now that we have this Light Every Birth initiative and we're working at a country level, we are working with governments, we are working with large institutions, and it's been really challenging to figure out how to navigate that. I wasn't kidding when I said I started by smuggling things in, and now we're trying to work in countries where, all of us are there because there's been either gaps or failures in the market or in governments. It's because there's been an absence of functionality. And so now we are coming in and trying to create functionality where the modus operandi is either lack of infrastructure or corruption, and yet we're trying to partner with these agencies. We have to partner with the government. And so we're trying to do things by the books right now, and we're seeing that that's going to slow us down in some ways. And so we're trying to figure out what is the right way to have these partnerships. How do you get buy-ins where you're not slowed down because of failures and challenges that are already existing in these countries?
Of course.
Yeah, actually, I just want to link in many of those countries, the lack of good governance and the corruption and the irresponsible governments, actually not talking about the United States, but in our content, it's really the problem. So this is why it became very crucial for this kind of initiative to make some difference. I met Laura in Bonn, and I talked to her. I like this program, and I was thinking to help also because it's the same situation or even sometimes worse than what it was being reflected in her presentation. So I went and I was excited about it, and I tried to meet with midwives school and also so we can go and take pictures and so we can submit it to help those health centers. Unfortunately, we've been stopped to take picture, because even the local governments, they don't want us to take picture from this very bad situation, and so they thought that we use this for political reason or something. And I was very excited at that time. I wanted to get some help in terms of this very good solar thing, but this is show you how much, I mean, what kind of environment we are even with this working on. If you need any more information about the organization, it's www.zainab.org, because I couldn't, actually I prepared some slides, but there is something wrong. I couldn't pull it from them. So you can find some more information, zainab.org. Yeah.
So we have reached the end of our time limit here, but let us really thank all of you for this incredibly enriching and special presentation. So thank you.